everyone for joining us today. Thank you for joining us for this webinar. And we hope that you will be able to follow through the entire presentation. Today's webinar is basically organized by the Africa Tobacco Control Alliance. And it's a report launch on COVID-19 and tobacco industry interference in Africa. So I hope that you can all hear me. I hope I'm audible enough.
Yes, we can hear you.
Thank you very much. So I think we'll start with putting the house rules first. I will begin by asking that if we have any question that will arise as we proceed, we'll request that we put it on the chat box so that we allow the presenters to be able to give us a good run of what they want to present to us, so that we don't also interfere with their train of thought. So I will also request that we try and mute our microphones and only unmute when given a chance to speak. I hope that we can also, put our video off, but we allow the video of the presenter to be the one on the screen. And I think, should there be anything else, we will be communicating on the chat. So once again, welcome to this report launch on COVID-19 and tobacco industry interference in Africa, organized by the Africa Tobacco Control Alliance. I'm hoping that we are all on, all those following from all parts of the world. Prof, I don't know whether you want to say something before we give the background to this launch. So as we're getting ready, I think I will go straight to the reason why we are having the webinar today. So ladies and gentlemen, COVID-19 struck. It has been roller coaster for all countries of the world. Of course, each and every nation in this globe felt the challenge that came with COVID-19. So largely in Africa, the pandemic had its own unique challenges. And specifically for us in the tobacco control industry, the pandemic was a bag of mixed fortunes. While we felt strongly that probably the COVID-19 will be the game changer in tobacco use among states in Africa, the tobacco industry was also looking at it as a silver lining. Well, today we are privileged to be in a position where we'll get the findings of a survey that will clearly highlight to us the magnitude and the impact that the COVID-19 pandemic had on tobacco control in Africa, and specifically how the industry maneuvered its way around this issue. So that's what we're going to be looking at, and we are privileged to have in our midst some of our distinguished presenters. If we can just have their profiles up. So on screen, we have Professor Olalekan Ayo Yusuf. Professor Yusuf is a well-known leader in tobacco control in South Africa, as well as globally. He's the current chair of and the head of the School of Health Systems and Public Health at the University of Pretoria in South Africa. Professor Yusuf has been involved in tobacco control research for over 20 years and has led several longitudinal studies on tobacco control, particularly in South Africa. Prof, as we fondly refer to him, those of us in the tobacco control realm, Is the director of the Africa Center for Tobacco Industry Monitoring and Policy Research, ATIM. We're privileged to have gone through Prof's hands. Our next presenter for the day is Dr. Catherine Egbe. Dr. Catherine Egbe is a research psychologist and public health scientist. She obtained a PhD in psychology and health promotion from the University of KwaZulu-Natal, Durban in South Africa. She's an alumna of the prestigious Center for Tobacco Control Research and Education, University of California in San Francisco, which is a WHO collaborating center for tobacco control. Dr. Egbe is a member of the Society for Research on Nicotine and Tobacco. She is currently the lead investigator of the following ongoing studies: South Africa's first global adult tobacco survey 2021, tobacco endgame in Africa, and university students' exposure to e-cigarette and hookah marketing and advertisement. She has authored over 50 academic publications, including over 50 papers in peer-reviewed journals. Dr. Egbe currently works as a specialist scientist in the Alcohol, Tobacco and Other Drug Research Unit of the South African Medical Research Council and was lead consultant for the AfroTaps project. Welcome, Dr. Catherine. And finally, we have Zanele Mthembu, who is a public health policy and development consultant, Campaign for Tobacco-Free Kids, South Africa, country coordinator. Ladies and gentlemen, those are our presenters for today. I hope, Prof, you're able to hear me now. Prof?
Hear me?
Yes, yes, Prof. We can hear you. We can hear you clearly.
Oh, okay, great.
Thank you very much, Prof. I think I will now throw the ball to you. Kindly take us.
Thank you very much.
Thank you, and good to see you after a long time.
Yes, yes, thank you. Colleagues, my role is very brief this afternoon. I'm supposed to welcome you all and introduce this milestone in tobacco control in Africa. Every branch of public health has identified the critical role of advocacy in translating research into policy and practice. It is therefore no surprise that this research report is launched with majority of audience being advocates from various civil society organizations across the region. This report by ATCAR reminds us of a corporate playbook on seeking every opportunity to interfere with tobacco control policy region. While the industry sees the African region as the last frontier for growing their revenue and rewarding their shareholders as per their corporate strategy, what they did not bargain for was the capacity in Africa to conduct research that can inform policy, like this one. We have strong scientists now focused on regional challenges like tobacco control, never than we in a way that we never had before. So why this report? The COVID-19 pandemic was not just a public health emergency of a proportion or magnitude that we have never seen before around the world, but because of restrictions of movement and the wearing of masks and many other interventions that was required to reduce the transmission. It was also a socioeconomic emergency, not just in Africa, but globally, in a magnitude that has never been seen before. So while the world required global solidarity in addressing this pandemic, the tobacco industry seized the opportunity to continue business as usual, using any means possible It is pertinent to note that this condition is just not a respiratory condition, but because non-communicable disease, existing non-communicable disease makes it worse. Both COVID and NCDs are unfortunately also related to tobacco use. Therefore, the relevance of tobacco control during the COVID pandemic. And reasonably, many governments, precautionary principle, decided to intervene by restricting tobacco use, with varying success, as you will hear from the report. We at ATEM, that host the industry interference database, we also picked up an increasing number of reports on industry activities at a time when we was looking at how to make everyone survive. They were looking at how to make their business survive. It was therefore important that ATCA decided to commission this research to document in a systematic way these activities of tobacco industry. We then hope that this report will leave behind not just the documentation of the activity of industry at a time in history when the world was faced with a public health emergency, but it will allow future researchers to understand the methodology that can be used to document tobacco industry interference using research or scientific methods. I must say at this point, I am currently in the conference of the World Science Forum, and you would not believe Philip Morris is also here. And they funded a particular session of world science journalism. Therefore, they are also trying to use science already to capture scientists or journalists who write science. In other words, it strengthens the results and important report like the one we're launching today, and why I hope after this report, we will all begin to understand the relevance of science in advocacy, because the industry has already recognized that and will be using the scientists. So I'm hoping that after this report, we would also strengthen our resolve to capacitate our advocates on documenting tobacco industry interference in the African region. More importantly, I'm also hoping that this report will galvanize the African governments to take smoking cessation or tobacco cessation more seriously. And finally, it is expected that this report has provided sufficient evidence for governments to act urgently on the implementation of Article 5.3. I would therefore now just like to thank you all, and I hope you listen attentively as this distinguished scientists and speakers provide the contents of the report and its implication for policy and practice of tobacco control in Africa. And I hope to join all of you in responding based on this report to further develop capacity in Africa. Thank you and enjoy the rest of the deliberations.
Thank you very much, Prof. That was quite insightful. And we all look forward to a very engaging discussion and a very eye-opening report from our experts. So without further ado, I want to invite Dr. Catherine to make her presentation. But just before she comes on, I want to request that if we have any question that we feel we want addressed by either of the panelists, let's just put it on our chat box. We will record it and we will make sure that all the questions that are coming through are answered. Should there be a suggestion or anything else that somebody feels that they need to contribute, they can also do the same. Thank you very much, Dr. Welcome.
Thank you very much, Simon. Permit me to switch off my video while I do the presentation, please. Please tell me when you can see my screen.
We can see the screen.
Okay, thank you very much. Okay, so I would like to thank everyone for joining us in this presentation to give you a snippet of the report on how COVID-19 has affected or impacted on tobacco control in Africa. I've already been introduced, so I'm just jumping right into it. Of course, funding was provided by the Africa Capacity Building Foundation through the African Tobacco Control Alliance, ATCA. We thank ATCA for trusting us to do this work. Just to mention that the funders did not influence the research process and the outcome of the study. I'd also like to acknowledge others who worked with me. I think I omitted Dr. Israel Agaku, who did part of the research. Pardon me for that. I just remembered. And then Ms. Pindile Ngobese, Christian Wenyi, who is the French speaker among the group, because we had to deal with both French, Francophone and Anglophone countries, and Sipe Sikle Gwambe, who also worked as a research assistant. We also want to thank all participating countries and their CSOs, the CSOs that we approached and who responded. We thank the actual participants because they actually took our time to speak with us, and sometimes we had to go back to them. We just want to say thank you very much for this work. Wouldn't have been done in this manner if you didn't cooperate. So now going on to the report, just to give you a background of what we've been talking about, COVID-19 and tobacco. We know that the pandemic, the COVID-19 was declared a pandemic in 2020 by the WHO. And since then, I think up to yesterday, when I checked, we have recorded over 650 million cases globally and over 12.7 million in Africa. And then we've also recorded over 6.6 million deaths globally, sadly, and over 250,000 deaths in Africa. We just to chip this in, that we know that tobacco kills about 8 million people annually. This is not to do like a crude comparison of the mortality from COVID and tobacco, but just to put it in context, because we are tobacco control people, so we always want to look at things from the prism of tobacco, the tobacco field and the impact of tobacco. We also know that smoking increases the risk of respiratory infections. It weakens the immune system, and it's known to cause or exacerbate many of the chronic health conditions. And these chronic health conditions are what we've come to see, come to know as some of the comorbidities that make COVID-19 more severe if a person contracts it, or if they are hospitalized, could even lead to death. So this study was aimed at investigating and documenting how tobacco control may have been impacted by COVID-19 during the pandemic in Africa. Of course, we know that the pandemic is still on, even though at a lower scale. But this was mainly done at the peak of the pandemic in 2020, 2021. And we also wanted to find out how the industry, the tobacco industry, may have exploited the pandemic to interfere with tobacco control in the continent. So we did a qualitative research in 2 phases. The first phase involved a desktop review of available evidence in the internet, and using other sources like published materials and gray literature, as well as social media. to ascertain the activities of the tobacco industry. The second phase was a qualitative interviews with key informants, and these key informants are those who are key tobacco control stakeholders in their countries, many of whom were working with various civil society organizations within these countries. So we wanted to collect first-hand information about their experience with the tobacco industry or their experience of the tobacco industry activities in their various countries. Because of course, being in one country, you can't know what is happening in another country unless you talk with them, if you don't want to rely on the media only. So in the first phase, just digging deeper into the methodology of the first phase, there were three core things that were done. The first one was the market scan of tobacco companies in Africa. The second one was the scanning of the social media handles of the tobacco industry. And of course, there are people who tag them as well. So anything that was associated with the tobacco companies and their names were explored. The third one was a review of the tobacco industry activities in selected African countries based on published literature and of course great literature like newspapers, reports, and so on. In the second phase, we did a purposive sampling because we're looking for key stakeholders only, not just anybody. And we did snowball sampling as well. So people referred us to others who may have more information to give us. We approached 51 key stakeholders from 17 countries. We got response from 23 key informants, and we were in 12 countries. And you can see on your right the table with the demographics of the people who responded to us and their countries. The participants were over 18 years of age, and they must reside in a country in sub-Saharan Africa, and they must have had at least 2 years experience working in tobacco control. So we wanted people who were real stakeholders. We conducted semi-structured interviews. We had an interview guide. We conducted the interviews in both French and English as the participants would wish. And those that were conducted in French, they had to be translated before analysis. All interviews were audio recorded, and the analysis was conducted using a software called Envivo. We did thematic analysis. The second phase had ethics clearance from the South African Medical Research Council Human Research Ethics Committee, because it's very important that we follow the processes that would make the work credible, so that when we speak about the findings, we would know that they are coming from a place where they have gone through the rigors of science to make sure that it's ethical, it represents what the people actually said. So just to mention that we had only 5 of our participants being female. I'm not sure why. I think they're the ones based on the people who responded to us, or maybe more males are manning the CSOs in the African countries. I don't know, but that's a discussion for another day. So jumping right into the results, from the market scan, we found that there were about 25 African countries that had at least one local or multinational tobacco manufacturing company. And of these 25 countries, we identified 3 regional hubs for manufacturing of tobacco in Africa. We had Nigeria, Kenya, and South Africa. And these regional hubs were servicing the sub-regions that they belong to. For example, Nigeria was servicing West Africa, Kenya was servicing East Africa, and South Africa was serving the Southern Africa. And so, of course, we hear a lot about the industry threatening to take their companies to other places and other countries if governments don't do their biddings. Some of these things that we see just consolidation of the companies to make them have more gains and more power when negotiating. The other thing was the scanning of the social media handles of the tobacco companies using their names. And what we looked at was what were these companies discussing on social media before the pandemic and during the pandemic. And there was a stark difference between what they discussed during the pandemic, before the pandemic, and during the pandemic. So before the pandemic, it was more about marketing, cigarettes, and there was one word that came up, Murungi. I'm not sure whether it was the name of someone or the name of, or a nickname of one of those viral words that went out. I'm not very sure of that. Dr. Israel Agaku conducted this section of the study. So, but during the pandemic, interestingly, everything changed and everything became about health. And the three most frequent words that were coming up on their Twitter handles were COVID-19, vaccine, and pandemic. Of course, I believe even us here, we know why, but we'll hear more about why later. Other results from the first phase was the fact that the announcement by British American Tobacco about their research and development of a plant-based COVID-19 vaccine seemed to have been like a game changer in terms of the discourse during the pandemic, because that generated so much airtime or footprints, media footprint, because a lot of media houses picked that up. A lot of people tweeted about them, and it kind of did a bit of greenwashing, or what some would call it whitewashing, of the industry during that period. I'll still talk more about this later on from the interviews conducted. So for the phase 2, we had 9 themes that we got from what the participant told us. We heard about the impact of COVID-19 in the region. We heard about the state of affairs of tobacco control in the region, the challenges that were faced by tobacco control, as well as the industry activities and efforts to promote their agenda during the COVID-19 pandemic. But I must mention that for the activities and efforts that they used to promote their agenda, we used the WHO's 6 strategies of tobacco industry interference, as well as the policy dystopia model, looking at argumentative and instrumental strategies, that is, things that were pertaining to the activities that they did and things that were pertaining to the arguments that they pushed out during this period. Of course, I'm going to talk more about that later. Other themes that we found were that about the impact of the tobacco industry's efforts in the region, as well as the business of tobacco industry during this pandemic. Also, where the government and the civil society organizations, their response or their countering of the industry efforts. We also got information about that, as well as the efforts of parties of the FCTC to implement laws that were more FCTC compliant during this period. And lastly, we documented the lessons that were learned during this period by as proposed or as mentioned by the advocates. So jumping right into the details about those themes. And the very first one here, I'm not going to talk about each and every one of them. So just to, you need to read the report. This is to encourage you to read the report after this presentation to get more details. And so concerning the impact of COVID-19 in Sub-Saharan Africa, 2 major themes were sub-themes were found, and these were the economic and social impact. Many of the participants mentioned that, you know, the COVID-19 actually affected day-to-day living and even the lives of people, with people not being able to go to work, people not able to fend for their families because they had to stay at home, knowing fully well that many of our people are doing jobs that will only pay them every day, or businesses that will pay them daily. So that was one impact that was, these were some of the impacts. And some also mentioned about students or children not being able to go to school, and of course the impact of that on the family. Secondly, they talked about the impact on the healthcare system, and I'd like to just quickly read the comment by a participant from Kenya who said, most critical and maybe obvious is the health system. COVID-19 has exposed the very underbelly of our health systems in the country because of the fact that the health facilities are struggling to keep up with what we have. Obviously, we are not as bad as we are hearing about what is happening in other countries like Brazil and all, but still our system is not ready, and never were they ready for a pandemic like this. I'm sure that this participant's statement carries the statement of every African country, because this was like the thread that was running through the take of the average African concerning the impact of COVID-19 on the healthcare system and how it exposed the healthcare system of our continent to be very weak. And I'm emphasizing on this because we cannot talk about preventing tobacco-related diseases without bringing into the discussion the fact that our health system cannot even handle a case of an explosion of tobacco-related diseases. And so COVID-19 is teaching us a lesson that, with COVID-19, it was hard to handle these things. And if we allow our population to be so impacted by tobacco use, and it becomes a case of us having tobacco-related diseases on an exponential rate, it will also show that we're going to have serious problems with our health system. So moving on the state of affairs of tobacco control in Africa, in the region, two themes also came up, and they were, first, the opportunities that the pandemic brought for tobacco control. It helped, participants mentioned that it helped them to understand that the fight for tobacco control was a good one. It gave them a good reason to continue to fight for tobacco control. And for advocacy, some of them said their advocacy is continuing as usual because, of course, with the implication of tobacco use and disease severity of COVID-19, it made them to see that they needed to continue to do the advocacy work, because there was now this motivation and this assurance that they were doing something that was impactful. On the challenges faced by tobacco control, there were about 6 challenges that were identified. They include that tobacco industry was promoting incorrect information. We'll talk more about some of these incorrect information when we are talking about the strategies that were used. Also, the inability of some advocacy organizations to function optimally. This was partly due to the lockdown and non-availability of funds, because funders had cut down because everyone was focusing on COVID-19. There was also reduced contact with the family, with the community members, because, of course, there was social distancing, there were lockdowns, people were not allowed to visit each other or go to the field to do some advocacy work. So participants mentioned that impacted on some of their work because they do community work. The fourth one was that there were concerns about the increased exposure of people to secondhand smoke, because more and more people were being made to stay at home. So smokers in the homes were now only be able to smoke at home, which of course exposes the non-smokers to more secondhand smoke. There was also the slower pace of policy implementation because everyone was focused on COVID-19, and of course the industry was doing their thing and trying to get their leeway with the government. So that kind of slowed down the implementation of some policies that were already in motion during just before COVID-19. Lastly, there was the impact on advocacy plans and financial challenges for the advocacy organizations, because of course, advocates plan, I believe, based on what we heard, they plan yearly, and then COVID-19 hits and the plan changes. And of course, because there's not enough finance to change plans so easily, it was a challenge for many advocacy organizations to even continue to function during this period. On the industry activities and efforts to promote the agenda, like I mentioned, we use the WHO 6 strategies to analyze this part of the results. Concerning the maneuvering of to hijack the political and legislative or policy process, we found out that some participants mentioned that the industry was exploiting the need for governments to raise funds to curb to mitigate against COVID-19. They were now using that opportunity to have access to government officials and presenting themselves as good members of the society whom the government can rely on. They were also donating PPEs and trying to, to do many of these activities like CSR activities that have already been banned. So the second one was exaggerating the economic importance of the industry. Of course, this was majorly seen when, for example, in South Africa, when COVID-19 lockdown ban warranted a ban on the sale of tobacco products because of how South Africa configured their alert levels. There was a pushback by the industry saying that they are losing business, the government is losing money. I'm sure Zanele is going to talk more about that later, so I'm not going to dig deeper into that. Concerning the manipulation of public opinions to gain the appearance of respectability, this is also linked to most of their CSR activities. And how they did that were in 5 phases. They were advertising and marketing. They were using social media to do the advertising and marketing, especially in places where they were not allowed to sell. They were also doing COVID-19 donations. They were sponsoring programs. They were advocating for issues which are anti-tobacco. For example, they were advocating against illicit trade. And illicit trade, we know that they are implicated. The industry itself is implicated in the promotion of illicit trade or participating in illicit trade. But then they came out as people who were advocating against illicit trade, thereby trying to manipulate the public opinion, because people will be wondering, they wouldn't think that the industry which is trying to fight against illicit trade is also part of the illicit trade. The last one was the media stunts about producing the COVID-19 vaccine. And the second aspect of it was saying that, of course, we had some studies that were published, especially on as preprints. Some of them, I think, may have progressed to full papers, but they were at that time mostly preprints. So they didn't go through the peer review process because they wanted them to come out quickly. Some of them were also people who have received funds from the tobacco industry. So these two, for me, when it comes to manipulating public opinion, apart from donations that were done, which at some point, I will mention it in the next slide, they were done via groups. They were not done directly. They were done via front groups. The media stunts about the tobacco industry developing a vaccine, as well as the issue about nicotine being protective against COVID-19, were 2 core issues that the tobacco industry used to change the narrative about the link between COVID-19 and tobacco, or they at least attempted and may have succeeded to some extent to change the narrative about the link between COVID-19 and tobacco. So the fourth one is fabricating support through front groups. I mentioned earlier that they, in some cases, of course, they know that they are not allowed to make donations in most of these countries, especially because the countries have laws banning CSR. So what they did was to use front groups to make the donations so that they would not be identified as the donors. And of course, that is not to say that the government would not know that they were the ones donating. So they were still using the donations to have access to the government and government officials. Concerning manipulation of science, I've mentioned the nicotine and then the development of vaccine, that falls under also manipulation of science, because I think up to now we've not heard anything about the development of vaccine anymore. And that's to tell you that it was just mostly a media stunt. Intimidating government with litigation was majorly seen in Uganda and in South Africa. In Uganda, it was they took the government to court to prevent the government from implementing the tobacco law, the regulations, while in South Africa, they took the government to court in two separate court cases, to court based on the lockdown ban. Moving on, the impact of the tobacco industry's efforts can be seen, categorized into three: the impact on government, the impact on the public, and the impact on the work of tobacco control advocates. Of course, with governments, they were now, in a sense, creating links that ordinarily would not exist with government, because they were now using their donations and their concern and their media stunts about producing vaccine and all those stuff to have access to government. On the public, of course, it was to create this positive image that they are good people who are also trying to solve the COVID-19 problem. COVID-19, with the way it came into the world with this overwhelming burden, a lot of people were just looking for solutions and didn't care where they came from. So the industry exploited that and tried to fill in that, to be in that space where they could be seen as maybe saviors or good citizens who are trying to solve the problem. And the impact on the work of the tobacco control advocate was that it was undermining the work of the tobacco control advocate, because all the things that were in some cases where the advocates have been able to create that bridge or that divide where the government officials know that they cannot interact with the tobacco companies, or they cannot do that at least publicly. In some way, some of those divides were blurred, because everybody was like, okay, you give us the solution, or you give us the money that we need to solve the problem, and the government didn't really care where it was coming from. So that was like a setback for tobacco control advocates. For governments and CSOs, their response and how they counter tobacco industry interference, I would, from what we found, we could say that some governments tried to do something about that. Like the South African government, of course, did not listen to the tobacco industry and were able to stand their ground until they were taken to court. In one of the cases, they won. The second case, it was only decided after the ban had been lifted, and they lost. But at least the government did not give in to the industry's tactics. For civil society's effort, I think that from what we found is that working with government was very important, because the civil society organizations were able to support the government and sometimes to call governments to account or to remind them of what they needed to do in terms of implementing their laws and not allowing the industry to blur the line. So in some cases where the industry was already donating stuff, the CSOs were able to point that out, and some of them were stopped, or at least stopped publicly. So you can never know sometimes. So the lessons learned, there are 4 lessons learned I'd like to share. The first one is the fact that the industry was quite innovative during this period. If we have to be innovative, if we have to counter them, we need to be thinking a step ahead. The second one is the collaboration of tobacco control stakeholders being very important, because the work in tobacco control is quite huge. No one can do it all. We need each other. And if we work together, you would see that some of the lapses that you would see in countries would be covered, because when one is doing the, for example, one CSO is doing the monitoring, the other one is doing write-up and writing of press releases and writing the media, others are organizing events. When they work together, that is when they will be able to counter the industry. The third one is the importance of strong legislation, because most of these countries didn't have any legislation that had to do with Article 5.3 that prevents them from interacting with the industry in the manner in which they interacted during the COVID-19 lockdown, COVID-19 period. So the importance of having FCTC compliant, strong legislation effectively implemented was also one of the lessons. Lastly, was the fact that it is very important that every opportunity to advance tobacco control policy should be used. Many of the advocates use the opportunity to encourage people to quit smoking and of course, to enlighten people about the impact, the harmful effect of tobacco. And this was one opportunity that many of the CSOs said they used effectively, albeit within the limited resources they had. So recommendations, I just want to run through these. The first one is that we have to really try to be proactive rather than reactive in terms of monitoring the industry. We understand how the industry acts. Many of us in this room who are advocates, we know, we have an idea of what the industry can do and cannot do. And we need to start thinking proactively and not just always waiting for them to do something and then we counter. There's also the need for the provision of tobacco use cessation intervention. I'm very happy that Professor Ayo Yusuf mentioned this in his opening remarks. It was one of the things I wanted to really highlight. And I know that it is not necessarily within the powers of the CSOs to create these interventions as part of their portfolio, but I will really want to encourage every civil society organization here to think of doing something about tobacco use cessation, because this is one gap that was so glaring during the COVID-19 period and which we saw, because you cannot tell people quit and then you don't provide help for them to quit. We know that more than, at least for South Africa and the GATS that we just concluded, about 80% of those who quit said they didn't use anything to quit. So we're dealing with a small number, but small numbers, sometimes how do I put it? The brain behind trying to do something to help that small number may be more impactful than just looking at the number. So I would like to encourage all the CSOs present to start thinking about it. Is it an app? Is it a website, just a page on your website? Is it providing counseling, providing a toll-free quit line? Think of doing something for your country so that at least you have something to offer those who are wanting to quit and need help to quit. Then the third thing is having FCTC compliant laws. I've mentioned that in the previous slide. I don't want to talk more about it again, but we all know the importance of this. The fourth one is that CSOs must push for the inclusion of Article 5.3 in their national laws. We know that there are so many battles we are fighting, but as much as possible, let's try to be making this case. It may not come the first time, it may not come the second time, but at least it's there in the subconscious of the policymakers that this is one part of the law that should be there no matter what. And this law, when it's there, when there's a law that is Article 5. That responds to Article 5.3, it will protect the public officials from industry influence. It will denormalize the tobacco industry's so-called CSR activities. There's also another recommendation that I'd like to make about building collaborative networks between CSOs and government. That is among CSOs and then between CSOs and government. Because among CSOs, sometimes there can be that problem of wanting to compete with one another because we're competing for limited resources. But it is very important that we collaborate, because the people that we are fighting against, when they are dealing with issues that are outside their companies, they are very much united. They may fight, but when they want to deal with us and the public and the government, they come together. We must take a leaf from that. We must try to work together, and then we must try to also provide support to the government so that they can do the right thing. Because if you want to antagonize the government always, then they see you as one of those people, and then they see the industry as their friends, because the industry most of the time doesn't like to antagonize them, because that's the fallout of antagonizing is that they won't be available to talk to you. So they always want to be friends with them. So let's also try and use that so that when they need us, they can come to us. And then when we need them, we can go to them. Then the other one is tobacco policies should be a whole of government and a multi-sectorial one, because we know that most of the time it's only health ministries that are championing it. But we see that when they talk about job losses during the COVID-19 lockdown ban, when they talk about tax losses and all those things, farmers not having things to farm and all those stuff, we can only make that case when we have the people in agriculture, the people in finance, the people in trade and industry, and all those other allied ministries to work with health. So we should always try and push for a whole of government and a multi-sectorial approach. And lastly is the just a call to advocates to also focus on discouraging governments from giving incentives and exemptions and tax breaks to tobacco industry. And of course, the removal of duty-free status for tobacco products, because all these tend to normalize the industry, and at the end of the day, creates that problem that we're trying to solve. In conclusion, I would say that Big Tobacco, they stepped up their meddling in 2020, and they accelerated this in 2021, even as the COVID-19 was sweeping around the globe. What's the solution? Policymakers and tobacco control advocates in Africa, they need to protect not just tobacco control efforts. We know Article 5.3 talks about protecting tobacco control against from the vested interests of the tobacco industry. But I also want to add is to protect the population, to protect the people, because the people are the ones who are affected by tobacco-related diseases. And basically, that is one of the things we want to prevent. And so we should protect the people, protect the environment from the commercial and other vested interests of the tobacco industry. Thank you very much. Over to you, moderator.
Thank you very much, Dr. Catherine. Thank you very much. I think that was a very, very informative presentation. You've done well. Really appreciate the kind of work that went behind putting together all this. And the interesting findings that are really coming out of this report. I mean, we've all been waiting with bated breath to see how the industry was trying to maneuver itself in the rapid challenging times that we're having during the pandemic. Somebody called Sise Darso Mengesha has asked a question, and I will throw it to you, Doc. So the question says, thank you, Doc, for the informative presentation, and congratulations for successfully implementing this important study in sub-Saharan Africa. I have seen in one slide that you mentioned Eastern Tobacco Company has agreed with government of Ethiopia to plant tobacco leaf in Eastern Africa. As my knowledge in Ethiopia, there's one tobacco company, National Tobacco Enterprise, that have a monopoly right to do tobacco business in Ethiopia. Will you please share me the source of your information, or can you explain a bit on this? Doc, if you can hear me?
Sorry, I was on mute.
Thank you. Please go ahead and respond to the question.
Thank you. So I want to be sure where that's, because like I mentioned, so this study was done in two phases. One was mining information from the internet about activities and things. And the other was from talking with CSOs and the reps from each country. So you would have to, I'm not sure I can remember that exact statement that the person who is asking just mentioned. I'm not sure if you can refer to the slide, that will help me to be able to answer that question. Because some of this information you would see in the report. I'm sure Atka is going to share the report after this presentation. So some of this information you will see in the report, the sources. And if it's from the phase 2, which is interaction with the CSOs, you would see that it's from the people who responded to us. And if it's from the phase 1, you would also see the source. Yeah, so I think when the report is shared, you'll get more information about that.
Thank you very much, Dr. Catherine. Since I think Dr. Catherine has tried to respond to your question, so I hope you'll be looking forward to the release of the report so that you can look through and see where the information is coming from. So once again, thank you very much, Dr. Catherine. Really appreciate your presentation. It was very informative. We invite anybody else who has a question to put it on our chat. We'll address all the questions as they come, and we will share them with our presenters as they continue. Should you also have anything that is burning, please raise your hand and we will respond to you. Moving on very quickly, I now want to invite Zanele Mtembo to make her presentation. Zanele, if you can hear me.
Yes, I can hear you, Simon.
Welcome, Zanele.
Thank you. If it's okay with the colleagues, may I also switch off my video, and I will switch it on after my presentation. I do want to say also thank you very much for inviting us here. And this is indeed a very important report that my colleagues have shared, the findings of which my colleagues have shared, particularly for us in our region, because we know how much Africa has become a playground for the industry, even at the West times when we're dealing with serious matters, serious human issues that are at stake. So without any further ado, let me just proceed. I will let me see, where is this thing? Here. I'll try to skip what has been mentioned in the interest of time, but I'm happy to take the questions afterwards. So I'm going to be talking about the key tactics that we as South Africa, we experienced, the industry tactics that we experienced, and of course, a few of our interventions and the lessons for the future that we've learned. So let me start. The economic manipulation, that was the greatest of them all, including litigation and of course manipulation of public perception and undermining the science. Now, regarding economic manipulation, now we're dealing with an industry that is very cunning. They know everything we do. They know every government plan, and they know how to manipulate it to their interest. They also know how to play to the public's emotions. And this is exactly what they did in South Africa. They played to the public emotions, knowing exactly of the economic situation at that time, the economic challenges government was experiencing. They capitalized on that. Why do I say so? At that time, our unemployment rate was high. I mean, it was close to around 30%. Right now, it's a little above 30%. Number two, the youth unemployment rate was also high. I mean, at this moment, right now, today, we've got a more than 60% unemployment rate of the ages 15 to 24 years. Now, they are aware of the government National Development Plan, which we call the 2030 Agenda, our path to national development, looking at health, social development, economic, and so on, as we aspire towards achieving the UN 2030 Sustainable Development Goals. They used exactly that to manipulate and advance their agenda. In this regard, these are the messages they were amplifying in the public, telling the public that, well, you know, government has implemented this ban. It will lead to job losses. How many more jobs do you want to shed when already right now there's high unemployment rate, particularly amongst the youth? They were also talking about the issues of development broadly, that, you know, currently, because of this ban, government is losing about 35 million rands. It's about how many dollars? You can calculate, divide by 16, 17. And they were telling the public that, imagine losing 35 million rands a day. That's the amount of money that could help you in securing jobs. That's the amount of money that can assist your children in acquiring a higher education. There's the amount of money that can electrify your house, your roads, and so on and so forth. So that is the narrative that they pursued at that time. And because they thought it's working for them. They thought it's working for them. And of course, in the media, they were very visible, and all over they had front groups pushing this narrative. And of course, this was coupled with the narrative around illicit trade, because they, again, were saying, telling the public that illicit trade has become worse because of the ban. A lot of these products are going cheap, and that will enable access by young people, and will have more young people using tobacco products and tobacco and related products. And of course, they were swinging the narrative around, now saying, blaming the government. And yet we know evidence exists that they are involved in illicit trade products, because all these products that are found in illicit markets, they are legit products produced by them. So that's, we know, that's how they exploited the economic situation and manipulated the economic narrative to suit them. The second thing that we experienced is this litigation which they launched. And I'm sure this was a case that was all over the world, because the two countries in Africa that instituted the ban, and of course, South Africa, our ban lasted for longer, from March to September, I think, 2020. And so then initially, what they did, the public was supporting the ban on tobacco and related products, because government was able to advance a narrative that says we are protecting the health systems from being inundated. Tobacco and related products are diseases of the lungs, of the respiratory system, and COVID is as well, and therefore we're protecting you, but also because of the worst outcomes if you are a smoker and you have these diseases, particularly the comorbidities. Now, the public was supportive of the ban initially, but as the ban progressed and it took longer, the industry gained momentum in terms of exploiting the very ban to suit them. Now they swinged the narrative around, and they turned the public against government, saying that they were using the rights narrative, the constitution. Now they were using the constitution to their benefit, saying government is taking away your rights to smoke, and yet we do know what the right says. They're saying government is taking your rights to make choices. Government is taking away your rights to do this and that, to smoke wherever you want, to use products wherever you want. Now government is chaining you down, you are locked down to your houses. And so this is a nanny state and so on. So that's the narrative they used. I will talk more about how we countered as civil society and partners, how we countered this narrative. Thirdly, the third tactics is manipulating the public perceptions. I've mentioned that, but also they were using front groups there was a petition that gained momentum against government as well around the July 2020. This is now when the ban was extended and it was intensifying. We're gravitating towards the extreme ban measures and the middle ban measures, and then they find space to exploit all this. Of course, they even use the issues around taxation, So basically what they were using is the issues around the ban, and they were pulling other narratives that works for them. For instance, increasing taxation, that it results into illicit trade, and so on, the issues of the economy. Now, undermining the science, this has been mentioned. There was during that period, there was a study that was, I think it came from France, if I'm not wrong, which made claims about nicotine being essential, not being harmful to COVID-related patients. And they had a field day about that. They tore it apart to their benefit. And of course, we do know the facts, we do know the truth. They were even speaking against WHO and our own scientists in the country and in the region. And so these were the tactics they used. And remember, at this time, as the ban increased, the public started becoming jittery against government, and they began to, in a way, listen to the industry. We can attest to this because even during the court cases that were launched by FITA, the Fair Trade Independent Tobacco Association of Southern Africa, when they litigated government against the ban on the basis of the ban and the basis that tobacco products are essential products. We were in court, we could see how FITA and the media exchanged, certain media houses, they were, overtly exchanging papers, exchanging messages and so on. But we were unfazed because FITA lost that case. Then we had BAT. BAT's case, key issue that they were challenging government on was that the ban was unconstitutional. It violated constitutional rights of the public, and they cited so many rights. And of course, government lost that case and they appealed, they won the appeal. But again, when the appeal was held, government lost it. There's been questions why government did not take that forward and appeal again. Why did civil society keep quiet? We kept quiet because, again, it's a strategy of the industry to redirect our minds, to divert the minds, and to divert attention so that we focus more on this litigation and forget about the bill that we're supposed to be pushing and advocating for. And government, they must forget about the bill that they're supposed to be processing up until its logical conclusion in Parliament. So what were our actions then as civil society? First and foremost, we needed to regroup and analyze the problem. What exactly is the issue at hand here about litigation, about the ban, about the economic narrative the industry is advancing, and about every other points they were raising. And so we literally had to tear this apart. So you would know that when it's a rapid response, you don't call on the entire broad church, the entire broad forum. You have to take a few people that you work with, but not forgetting the broader allies. That's how we worked. And of course, we are grateful to our own scientists that were with us all the way and that were going through scrutinizing the tobacco industry litigation papers, the papers that were filed. We had our own, some of them are here, our scientists that were using science and engaging with other scientists in the globe. That worked to our favor as well. And so that's what we did. And of course, that enabled us again to work directly with government, because then government, we have a good working relationship and understanding technically and otherwise with government, particularly the National Department of Health. Now, as well as the other affected departments. During this time, the leading department was the Department of local government. Allow me to use that word. We have a long and complicated word for that department, but it's local government in simple terms. So we were working directly with that government, Department of Local Government. And so as civil society, we became the go-to for this department, whatever technical information that was required. And they consulted us, and we further consulted beyond our borders, because tobacco industry tactics, they know no borders, we know that. And then we had to develop our own strategies and interventions. We really capitalized on the media because of the importance to counter the narrative of the industry. And first and foremost, our narrative was focused on this economic manipulation and the misuse of the Constitution. You know, the industry really misused the Constitution. And so we then turned that around. We reframed the narrative and alerting the public exactly what are the constitutional obligations of government. First and foremost, government has an imperative to protect citizens from any harm of any nature, to safeguard the health of the citizens, because safeguarding the health of the citizens is safeguarding the economy. Safeguarding the economy is safeguarding everything else which the country treasures most. And so we used the same narrative the industry was using, now reframing it and putting it correctly, because they were distorting the facts. The third strategy that we used, I've spoken about the partners and the allies and determining roles and responsibilities and so on and so forth. And so what are the lessons that we learned then during this period and with our own interventions? Now, firstly, the importance of working with credible research institutions. That was very key for us, because even in court, the lawyers for the industry challenged some of the science. Some of our researchers within this group here today, their names were mentioned and they were, challenged, but we were not faced, because we know these are researchers with international standing, international good standing. So it helps to work with people with institutions with good names, who have done good work, credible work. And so that's what we did. And we use our own as well, might I add. We relied mostly on our own local research. And of course, because COVID was new for everybody, we needed to cite examples from elsewhere. Secondly, mobilizing support, local support and internationally, that was very important for us. During this period, to our greatest surprise, we garnered more advocates for the bill, particularly from different health professional groupings, the pediatricians, the lung health, the heart health, and so many other, even from the unions, the women's group, the youth groups, even from political parties. We were able to secure support for tobacco control broadly, for the bill, importantly, but also for the ban. So we garnered much more than we bargained for. And these are the organizations that we are working with now, going forward, advocating for the bill to be adopted and passed with speed. Internationally, yes, thankfully, ADCA, yourselves, and the membership of ADCA in the region were grateful for the support you provided. The letter of support which ADCA membership provided to us in support of the ban. That letter, we presented it to the Minister of Local Government, who was the champion for this ban. And that letter was read, literally read in cabinet. And everyone was like, who is ADCA? Tell us who is ADCA. And of course, we needed to say so that either than the South African movement, we do have a regional movement. And as Africans, we're working together, but also as the global community of tobacco control advocates, we work together because we did receive international support as well. The other third lessons for us is that do not allow the industry to control the space. I indicated that there was a time where the society was convinced, was in support of the ban, gradually they tended to be hesitant, and they were moving with the industry. Why? Because at that time, the industry gained momentum in the space. Of course, they've got other measures that we do not have, the financial power that they use all over the show, that we can say, but also, they've got every other strength, that, they use, that did not deter us, because we were there in the space as well, but do not control, do not allow them. We kept reframing the narrative. They would talk about the harm reduction. We would tell them that harm is harm. Less harm does not mean no harm. And so that is how we kept reframing the narrative. So whatever they were saying, we will reframe it to health, because health is important even for economy to progress and to benefit everyone. We do need a healthy nation for a healthy economy. Now, of course, identifying the key messages and key spokespersons in the media during this time, we had enormous media coverage. And of course, we were pushing much as the industry was pushing. We had to sit down and identify the key messages. We needed to ensure that we all speak in one voice, because during a crisis, there's a danger that you may speak across purposes. So we had to develop a frequently asked question and answer sheet for everyone within our team to have access to, so that everyone at any given point in time, whether in the media, whether in your office, whether in your church, whether in your community, in your group assembly, you speak the same language. And we did that. And we still use that approach, by the way, even now. And those messages are still valid even now, because we are still advocating for the bill to move forward. And we still have the same industry that is still using the same narrative against the bill now moving forward. Yeah, of course, and the capacity building of the media. Unfortunately, we could not do this because it needed a face-to-face engagement. But those media companies that were already reporting positively, we identified them, and those are the ones that we worked with continuously during this period. Yeah, so in closing, I do need to say that this was really an important phase for us as tobacco control community in South Africa. This was an important phase for us to once again reignite and revive the movement, tobacco control movement in South Africa, but also revisit what is important and the key messages, and also to intensify support to government, because we really were available for government 24/7 at any given point in time. And they really relied on us from the science, from the policy perspective, from the prescripts of the FCTC, and so on and so forth. So this was a period really of importance. And of course, we have to document. Catherine spoke about documentation. We will have to document this because there are good lessons to be learned, and particularly around how we regrouped and how we managed to face the industry head on. And from that point going forward, we've got people we've got targeted organizations, advocates that are focusing on different aspects in dealing with the industry, but also policy aspects of our bill. And we are stronger now than before because of this ban, which came unexpectedly and lasted for so long, but it worked to our favor as well. Needless to say, of course, the industry benefited somehow because of illicit products that were all over and sold. I mean, there were WhatsApp groups that were selling these products. We are even told, it was all in the media, that there was even drones that were delivering these illicit products, and they were selling at phenomenal prices. And so, colleagues, allow me to end there in the interest of time. We are happy to take questions and points of clarity. Thank you, Simone.
Thank you very much, Zanele. Really appreciate that presentation. It was very, very, very well done, quite informative, and really brings out the spirit of tobacco control, and when we look forward to engaging with it later on. In the interest of time, ladies and gentlemen, if you allow me, I will want to share with us the report. A moment, let me just share my screen.
The report is already put up.
Okay, thank you, thank you.
Yep.
Thank you. Thank you, Caleb. So just before we get to the questions, because I can see there's a question that was asked, we want to share with you the report, and this is how it looks like. So this is the cover page of the report. Then we have the acknowledgements and the abbreviations and acronyms. We have an executive summary of the report. We have the table of contents. We have the background, introduction, the objectives of the study, research questions, the conceptual framework, the methodology, data collection procedures, the respondents, how they were drawn, and all these things. So once we are done with this webinar, we should be launching this report officially, and we invite all tobacco control advocates to just glance through and have a feel of what our team that has just presented to us was able to put together. I believe this will form very good material for those of us in the media space, so that we interact with the content in a good way, so much that we can be able to generate very key content for our publications, for the media, and for other engagements. So this is a report. This is a report. Very well done piece of work. Quite a lot of effort went into it, and we're inviting everyone to read through, to share, and the media. We're inviting the media to also take a dig at this and look at the various angles that the findings have been presented to us. Look at what the government is supposed to do, the advice, the recommendations to the civil society, the different tactics that were being used by the tobacco industry during the COVID-19 pandemic, and just highlight to us some of the issues that we need to bring out to our audiences. Thank you very much, Caleb, for this. It's work well done. I'm seeing we're looking at the final pages of the report. So a link has just been shared on how to access the report. This can be accessed through the link that has been shared, and I'm sure it will be circulated to us again through email and all our platforms. So kindly feel free to share and just take time to read through the report so that you're able to appreciate the findings. So very quickly, again, because of time, allow me to just jump into the questions that were asked. So yes, initially, Cisse, you had asked a question, and I hope that the response that was provided was adequate. And just to add to what was said, I can see Dr. Catherine also gave some feedback. And she's also provided the source of information about Eastern tobacco planting in Ethiopia. And she's also mentioning that Ethiopia has Japan Tobacco International. So Dr. Catherine, you want to say something about this before we move to the next question?
Thanks, Simon. Just to mention that, remember, I just checked again the report to see where that particular information was mentioned, and it's on the scan, the internet scan. So, like I mentioned, there are two phases. The first phase is scanned, social media handles is scanned, gray literature and published literature. So anything, newspaper, reports, were scanned to find out what's going on with tobacco in the region. And one of the things that came up was this news that was carried that Eastern Tobacco, which is an Egyptian company, by the way, was going to be provided about 50 acres of land in Ethiopia to plant tobacco. So that's why you see it there. Yeah, so it's not like they're a company fully functional in the country, at least not by the report, but they are offering, or they were being given land to plant tobacco in Ethiopia. So that's why it came up there.
Thank you very
I
much,
hope I've
Dr.
answered your question.
Hope so. Sise, I hope the question has been well answered. I will also read for you a response from Atka. Hi, Sise. Eastern Tobacco Company, or Eastern Company, is an Egyptian entity. It was included in Ethiopia because it signed an agreement with the government of Ethiopia to plant tobacco in the country. This information is highlighted in the report. And of course, like Dr. Catherine has mentioned, you can just look through the report and see how that has been presented. I don't know whether Sise has anything else to add to that, but I want to move very quickly to another question by Edward Jusu. He says, thanks for the good presentation. My question is, what further steps can we take to ensure that the tobacco industry does not take advantage of future pandemics? I think Dr. Catherine, you can handle this as well.
Yeah, thank you, Edward, for asking that question. I think my recommendations, I think the one but last slide had my recommendations. Those are what I would recommend that should be done. We should be proactive rather than reactive. We should provide tobacco use cessation intervention. I say this strongly because when British American Tobacco took South African government to court, one of the, how do you call them, co-litigants, one of those people they brought on board to co-sue the government, or one of those groups, were people who were smokers. So they lobbied smokers to join them in the suit. So we must be seen, I believe that we must be seen as people who are not against smokers, but against smoking. And we can only be seen as people who are not against smokers if we are doing something to help smokers to quit, not just saying, go and quit. We know that most people, like I mentioned during my presentation, we know that most people can quit without help, but there are some people who need help to quit. If you want to provide counseling, please do. If you want to provide a toll-free quit line, please do. If you want to provide an app or a website where people can go log on, just provide something so that at least you can be seen to be interested in helping. Because we know that the harm reduction argument is the one that is now being used in Africa now. That is where they are using to come into, to manipulate science to come into tobacco control. You cannot talk about harm, you cannot counter harm reduction without doing something to help people who they are targeting with that harm reduction argument. So for me, it's a very big thing. It may be small, maybe targeting a small group of people, but let's try and do something, even if it's to highlight what is already existing in the public space, because we know that there are so many apps that are available. We can scrutinize some of them and adopt some of them and say, this is what we'll be recommending to people who want to quit, who need help to quit. And of course, providing building collaboration between CSOs, and then between CSOs and government, to make sure that you have access to government, to be able to be called upon to provide support to government. In South Africa, it happened because we were able to now be called upon to provide an affidavit, for example, to support government's tobacco control efforts. We also we're also called upon if they need information, if they need evidence, if they need, of course, because I work with the South African Medical Research Council, mine is it's a little bit different from the others, but what I'm calling on CSOs to do is to be the go-to organizations if government need information about the tobacco and tobacco control, the harms caused by tobacco, about how to deal with the tobacco industry. And it can only be that if, for example, you, like what Simon said earlier, you start to use some of this information that ATCA is churning out, this small research, this information, booklets or whatever. You should be seen as a resource by the government so that they can come to you. Otherwise, they go to the industry and get information from them. And then we should also be focusing on pushing for certain things. For example, pushing for other ministries other than health to be involved in tobacco control. And we should also be pushing for other sectors other than health to be involved in tobacco control. We should be pushing for the government not to give incentives and exemptions and tax breaks to tobacco industry. We should be pushing for the removal of duty-free status for tobacco. For me, that's a hard one, but we can only start doing something, and little by little, what we are doing will make a mark and things will change. Thank you.
Simone, may I add before you close? You allow me?
Go ahead, Zanella.
Yeah, sure, thank you. Yes, I fully agree with Catherine. I also want to add that, so exposing the industry should be an ongoing exercise by the advocates, as advocates, because another pandemic will come. And so by that time, or something else would happen, by that time, at least we must have achieved a few objectives. The main being ensuring that in our governments in Africa and beyond, governments adopt a whole of government approach in dealing with the industry, because this silo approach doesn't work. That is why we've got these tax breaks. That is why we've got a tax duty-free products, because each ministry, each department treats the industry, in a manner that would suit them, because all that each government department is doing, they are pushing their own targets to say, we've got to raise 20 billion. If the tobacco industry can give us 12 billion, as they claim in South Africa, so be it. Let's go. Let's create incentives for them. So if there's a whole of government approach, it would be much easier. So it's incumbent upon us to continuously expose these tactics so that governments can understand that the industry is not who they claim they are. I mean, for instance, if you go to FITA, Fair Trade Independent Tobacco Association of Southern Africa, just the first line in their website, they are saying they are mindful of the socio-economic climate in Southern Africa. So just that, I mean, really, that's an operative statement, and you can tell that theirs is to exploit the socio-economic climate to their benefit. So we need to be raising awareness to government about this so that they know who the industry is, what they do to gain favors, but also what they do to gain more profit at the expense of public health. So yeah, that's all I want to say. And manipulating the public, because that's what they're good at, how they manipulate the public, but even how they manipulate government. We can attest to that, Simon, if I may. Recently in South Africa hosted the Trade and Customs, the Africa Trade and Customs Summit, which was held around early November in South Africa. Now, for all of us here, we were like, what on earth is happening? And of course, we had to call on ADCA to mobilize support in the region, the same way we mobilize support here in South Africa. And what happened? We managed to get the industry, because the PMI was sponsoring that Africa Trade and Customs Summit, which was held in South Africa. So we mobilized support locally and around, and PMI, their sponsorship, their logo was removed from the website of the sponsors. And of course, it was too late for them to be to be removed in certain platforms, but at least they were no longer as visible as they had planned to be at that summit. And how did we achieve that? It's because of this intercontinental partnership that we forged. It's also because of this alertness, because in tobacco control, we got to be super alert. It's also because of the unity that we have as advocates and the support that we have garnered throughout. And we need to continue on that because so much is happening and so much is still going to happen. Thank you.
Thank you very much, Zanele. I think that's a very good exposition of how things are supposed to be done, where we are, and as tobacco control advocates, what we need to do. For those of us in the media space, once again, I think this is a very good opportunity to be able to just go through this report, look at the various issues that have been brought up, see how best to utilize this content, and create a very good environment for tobacco control in Africa. I will move to a question by Francis Bowley, and he asks, have there been any large-scale studies linking the increase in smoking to COVID-19 lockdown? And the second part is, if yes, what are the results? I don't know whether Dr. Catherine, you'd be willing to take this.
Thank you very much, Simon and Dr. Boli. I'm not aware of any large-scale study, and I'm not even sure I understand what the reference is to about increased smoking, because even in South Africa, we've not, at least based on studies that were conducted during the lockdown ban, and what we got was a not so many people as much as we would want, but not also too small that quit. What I mean by this is that, we know that nicotine is very addictive, so it's very difficult for people to quit. So have 16% of smokers quitting is a feat. But many people who were following the lockdown ban were thinking that, okay, everybody who was smoking would have quit at the end of the lockdown ban. That was not the intention, really, because there's no way that you get 100% people quitting. So because they looked at 16% and then they said, oh, 16% is not big enough. Like we didn't achieve what we wanted to achieve. But we know that based on what we were doing, we're just looking for an increased number of those who would be discouraged from continuing to smoke, thereby increasing the likelihood of them not suffering severe symptoms if they have COVID-19. So I don't know of any country or any study that has shown that there has been an increase in smoking during COVID-19 on a large scale. I know that there were some countries where some studies were done and they looked, and some people said they smoked more. Not that there was increase in smokers, but they smoked more because of the tension, because of the uncertainty, because of the fear. So it was a way of dealing with their anxiety that COVID brought to them, but not necessarily that there was now an increase in the number of smokers. I've not heard of any study like that.
Thank you very much, Dr. Catherine. I'm sure Dr. Boli has gotten a good response to that question. And probably as we proceed, there will be more research on the area of COVID. And we'll get to see the issues that are going to be come out of that. So then again, additional resources related to the subject matter will be published on the page that hosts the report. So there'll be additional resources on this. Somebody, Mary Asunta, said, since BAT is using illicit trade as a scare tactic, we need to counter this. Can advocates send any info that they may have seen in their country to ATCA? For example, BAT gave the government a vehicle to destroy smuggled cigarettes. Wow, it's interesting. Then someone called Saram Mawarere is asking, how would you advise the media to continue disseminating info in a country that lacks political will? tobacco investigators are protected by, tobacco investors are protected by security and government arms, yet this is a very government giving policies on tobacco. Probably I can try and respond to Sarah. I mean, within our small spaces, there's always something small that we can do. And especially that we, as tobacco control advocates in this part of the continent, we are privileged and honored to have access to such documents as the report that which has just been presented to us by Dr. Catherine and the others. I mean, we can always try and see how best within our spaces to disseminate this kind of information. I am aware that most governments have a stake on issues of tobacco. So tobacco control is a very sensitive area, but you can always find a way to just throw in one or two things that we pick from the report. So I'm sure that is something that we may want to follow through. I'm not seeing any other question. So I think then in that case, we want to encourage that if there's any other question.
Can I add to the question on what media can do?
Yes, Doctor. Yes, Doctor.
Okay. So just to add to what you and I like what you said about just continue doing what you need to do. Another way is to cover the activities of tobacco control advocates. So when they are having lectures, when they are having programs, if you can cover the activities, because they don't have the money like the tobacco industry to buy media time. They don't have the money to buy pages of newspapers for advertisement and all those stuff. But if you can cover the activities, you are also promoting tobacco control in your country, because whatever activities that they are organizing is going to be promoting tobacco control. So that's one way, apart from reporting events like this. And where there is a key issue on tobacco happening globally, it's an opportunity for local media to talk to tobacco control advocates in the country and give like a situation report in their own country. They do it a lot here in South Africa, where maybe something happened maybe in the US, or a new study came up in the UK, and there's a small media buzz about it. Then South African media, some of them will come to us to say, what's your take on this? So, and then when there are key results, also, I don't know about the experts in these countries in terms of the researchers, but another way for the media to be involved is when you do a study in your country that shows certain findings that are very important to promote. It's also another opportunity for the media to promote tobacco control. For example, the GATS, the Global Adult Tobacco Survey, I think South Africa is the 9th or the 10th country that is doing it. When we did it, we did programs, and then we tried to get media attention around it. These countries that have done it in the past, how much media coverage did they have? So that's another way to promote tobacco control. Use whatever opportunity. I mentioned in one of my slides that make use of all the opportunities that you can to promote the discussion, because the discussion is where the whole issues are taking place. So if you can continue to have that discussion in the media space, you're already owning that media space, so that when the industry comes, they're not going to be owning it. They're not going to be directing it. They're not going to be only pushing their narrative. Thank you.
Thank you very much, Dr. Catherine. I don't know whether there's anyone else who wants to add anything. Zanele, I've seen you have commented, but even as you want to say something, I want to read a message here from Judith McKay. Excellent seminar. Congratulations to all colleagues concerned. Judith McKay, Hong Kong, China. Thank you very much, Judith, for your feedback. Anybody wants to say something before we move to the next?
So Simon, yes, I think the media aspect is very key, because they can make or break you, right? We know the media can make or break you. And so at the end of the day, it's incumbent upon us to ensure that it's our voice is heard, our voice supersedes in every situation. I mean, we do it here in South Africa. We capitalize on any event, on any situation, and we try and find space to amplify at least the bill. If it's not just the broader tobacco control message, we just say that is why we need the bill to be adopted right now, so that this issue can stop. For instance, so that the smuggling of tobacco products can stop, right? So that the prevalence, right now there's the prevalence of youth of smoking, as per Gates conducted by Catherine, is high, and we're using that to say that is why we need the bill. So we use every event, every situation. There must be something for us, in it for us, and that is what we do. So we have a media team that is so alert, who are always in the media, picking up what is being said today. How can we use that to best advance our narrative? However, we're mindful of not to dilute our message. That's very important. We are really mindful, because when you do that, there's a danger that you may get lost. Your message can get lost in the bigger scheme of things. For instance, in politics, when the political agenda is topical at that point in time, you just have to be careful, perhaps tone down, but whilst, again, reviewing the strategy to see how can you create space for yourself.
Thank you very much, Zanele. I can still see Sarah Mawarere has some comments she's making. Media signs that they are not party to any tobacco activities. So those media can't attend those tobacco companies' activities. It is a dilemma that the media is in where there is double standard. Maybe just to also give my comment on this is that I am in a country where the media is also deeply in this tobacco industry issue. But we push and try to make sure that at least we get information out there on what tobacco industry is doing to counter the tobacco control strategies that are being put in place. I personally have been pushing a lot of information on tobacco industry tactics through the mainstream media. Most of it doesn't get published, but we thank God that the little that gets published gets to see the light of day. So I think we all play our little part, as I said earlier, and I'm sure we will get some results out of it. So before we close, we are going to have a group photo. But then just, since I can't see any other question, I can't see any other reaction, allow me to quickly just highlight a few things that I've picked from the report. Number one is that the tobacco industry used the COVID-19 period to spread incorrect information in order to promote its agenda. I mean, this really comes in as a shocker, because you'd expect that in the middle of a pandemic, they should have tried to see how best not to even talk about such issues, because their activities were even seen to be amplifying the effects of COVID-19. So quite some interesting and intriguing findings in the report. So I welcome everyone to look at it, spend some time, go through it, see what the team has been able to put together, look at how the tobacco industry has continued to remain relevant in the midst of a serious pandemic such as COVID-19. Basically because they have strong arm tactics that they employ. They have the financial muscle, they have the manipulative muscle, they know how to position themselves as being key allies of governments across the world. So I welcome everyone to read this report and just try and synthesize what has been put to us. I am not seeing any other feedback or question from any of our participants. And I want to really thank everybody for taking part in this. I want to commend anybody and everyone who created some time to be able to listen in and to give insights into what has been presented to us. Probably at this point in time, before we say that the report has been launched, will we be willing then to take a group photo? Will we be willing to put on our video. All of us, including the attendees, let's switch on our cameras. Let's give it a very broad smile. I'm sure our Secretariat is busy taking the group photo, even as we hold on to our smiles. Caleb, you know, when people smile for a long time, it becomes a plastic smile and stops being a natural one. So I hope as Dr. Catherine and Zanele and everybody else is smiling, you're also busy snapping away.
It's all good. Thank you very much.
Thank you very much. Thank you very much, Caleb. And to everyone who's taken part in this, I think this is the time now when we declare that the report has officially been launched. For me personally, this is a positive milestone in the era of tobacco control advocacy. I will be doing my bit in promoting the contents of this report through the available outlets, through the available channels, including my personal one. So let's all do our bit. Let's hope to keep this fire burning. And in the whole spirit of Africa Tobacco Control Alliance, we want to see an Africa that is tobacco free. Thank you very much. I want to hand it back to Caleb to guide us through the rest of the remaining bits. Thank you so much.
Well, nothing to add, just to say Attica is grateful to all who have been here participating in this webinar. And like it was mentioned, the page that hosts the report is going to be fed with more information, more resources, including a report that was published by Dr. Boli. He talked about it a while ago. So we're going to furnish more information and more resources for you related to this subject, including the recording of this webinar. You'll be able to get all of that on the page that has been shared to you that hosts the report. And we're also going to send all this information to everyone who registered for this webinar through email. Thank you very much. Thank you, and we wish you a great day ahead. Bye.
Thank you.
Thank you.
Bye.
Thank you
Bye,
very much.
everyone.
Bye-bye.
Thanks very much, moderator.
Okay,
Bye.
thank you, Dr. Catherine. Bye.
Bye.